Good day and welcome to the Oakland County Megacast on our family of TV and radio outlets. Not just your regular broadcast or simulcast, not a podcast, so to speak. Elements of a little bit of everything that we can have in media to bring you the news that you need to know from your backyard right here in Oakland County in places like West Bloomfield, Kegel Harbor, Orchard Lake, and Sylvan Lake on 89.3 Lakes FM and on Civic Center TV. In places like Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin on Birmingham Area Municipal Access Television on Comcast Channel 15 and AT&T Channel 99 on their Government and Public Access and Education Stations Guide. In Bloomfield Hills on the radio 88.1 WBFH, the BIF, a service of the Bloomfield Hills School District under the leadership of station manager Ron Whittables. And WAHS 89.5 Avondale Community Radio, that a service of Avondale Schools under the leadership there today, pressing the buttons and doing everything we need to get us on the air. A junior over there at Avondale High School, Logan Pizzuro, a good friend of us today, helping us out, get us on the radio all across our coverage area here in Oakland County, and plenty going on throughout Oakland County today. We'll get right to the headlines this morning. President Trump signed an emergency declaration for flooded Michigan communities yesterday as he visited in the state. The declaration authorizes the Department of Homeland Security and the Federal Emergency Management Agency, or FEMA, to coordinate disaster relief efforts. You heard yesterday on the Megacast, Governor Whitmer at her press conference said that she was hopeful the president would sign the disaster declaration, and she would be willing to also visit the disaster site with the president should he be desiring to visit the site and see it firsthand. That and other important coronavirus stories are on our website at civiccentertv.com/coronavirus. There you can find all the latest information. We are updating this page daily to put the most up-to-date information about COVID-19 in our state and in our county and in your local community on this page. And we talk about the sense of unity yesterday in disaster between the president and the governor. A little less of that unity and a little more tension between the Attorney General, Dana Nessel, in the state of Michigan, and the president. The Michigan Attorney General and Donald Trump are feuding over Twitter after the president's visit to the Ford plant in Ypsilanti yesterday. Interest was high whether he would wear a mask or face covering of any kind, and while it was reported that Trump did indeed wear a mask during parts of the plant tour, he chose not to wear a mask in front of the public, sparking a heated battle between himself and Michigan's Attorney General Dana Nessel, who had some very tough words to say for him on CNN yesterday with Wolf Blitzer. She said in Michigan, of course, that's the law in terms of wearing the mask. And when discussing the president not wearing a mask for the entirety of his visit, Dana Nessel was quoted saying, quote, "A court just upheld the governor's orders just hours ago. And even in Ford, it is their own policy. The president is like a petulant child who refuses to follow the rules. I have to say, this is no joke." So not all the tension, I guess, has been broken between leaders in Lansing and the president at the White House in Washington, D.C. Other stories making headlines on CivicCenterTV.com. We heard in that last story about the judge's ruling on the governor's actions. Judge Cynthia Stevens has ruled in favor of the governor in terms of her actions, deeming them legal under the Emergency Powers of the Governor Act of 1945. The judge, however, did side with Republican opposition on the governor's saying the governor did overstep her powers under the Emergency Management Act of 1976 in redeclaring a state of emergency without legislative approval. Other big news on CivicCenterTV.com/coronavirus. Michigan retail, showrooms, medical, dental services will reopen with some rules. Governor Whitmer announced at her press conference on Thursday that she is lifting portions of her earlier stated stay-at-home order and reopening more parts of Michigan's economy. People will be allowed to engage in gatherings of no more than 10 people immediately, as long as they continue to adhere to social distancing guidelines and wearing facial protections in enclosed areas. Retail businesses and auto showrooms across the state will reopen on May 26th by appointment only for those customers. This did not include bars or enclosed dine-in restaurants in the majority of the state. Non-emergency dental services and non-essential medical procedures, as well as veterinary services, will also resume, that beginning on May 29th. As of now, gyms, theaters, libraries, bars, restaurants, and other public entertainment facilities will remain closed. And Governor Whitmer even said at the press conference she does she said that we should expect another short, brief extension of the stay-at-home order coming very soon. The Centers for Disease Control released guidelines for reopening schools this fall. Of course, we talked yesterday on the Megacast with how some of those, with Deanna Barish from the West Bloomfield School District, about how some of those guidelines went into the West Bloomfield School District formulating their plans for reopening school operations come the fall. That story in full on our website at civiccentertv.com/coronavirus, as well as other stories from around Michigan, around the Oakland County area, and of course this great helpful map, the Oakland County coronavirus cases by zip code. As we click on that, it'll take you to the map. It'll give you the current outlook of the cases in Oakland County, so you can see where still some of the more heavy areas, like we see here in Pontiac on the TV side, in Lathrop Village, and in Southfield, and the areas with a little lighter of a load of coronavirus cases, like we see in White Lake and in Oakland, and in parts of Orion Township and Lake Orion. Those of you watching on Birmingham Area Municipal Access and Civic Center TV see on our side. That news on civiccentertv.com, along with other coronavirus resources for you from resources you can trust: the Centers for Disease Control, the state of Michigan, Oakland County, and the municipalities in our coverage area. Direct information that you want to know from sources that you can trust. And on top of those sources you can trust, we have plenty of sources from throughout the communities in our coverage area that we'll be talking to throughout today's show, including Dr. Jamie Taweel, an internal medicine specialist at Grand River Medical Associates. We'll check in with him and see what different medical offices like dentists and optometry offices are doing to prepare for reopening here in the near future. We'll speak with Rochester's Police Chief Steve Schettenhelm to cap off the first hour. And in this second hour of the show, we'll speak with Dr. Melanie Schwartz, get a psychological angle of how the reopenings will affect people's psychology and the psychology of returning to schools in the fall with a different way of operating. How's that going to affect our students? How will that affect our teachers? And how will all of that affect the education system in the state of Michigan? We'll have a little more insight on that from our psychology expert, Dr. Melanie Schwartz. We talked earlier this week with Monsignor Smetanka from the Archdiocese of Detroit about how churches are beginning to reopen. We'll talk with Rabbi Daniel Schwartz in the second hour of the show from Temple Shir Shalom in West Bloomfield, and see how the Jewish faith community in Oakland County is looking to respond to lifted restrictions and possibly reopen down the road. We'll talk to Erin Finn, a former track star at West Bloomfield High School and the University of Michigan. She was an Olympic hopeful. The Olympics, of course, suspended for 2020. They will happen in 2021 if all goes well. We'll talk to her about that, how that's making her feel, how she's updating her training. She's also a medical student at the University of Michigan and has a master's of public health and epidemiology, so we'll get some information from her about where we're at in all this process. And then Dave Scott went up north to his place there, and we'll check in with him, see how things are going in northern Michigan as their restaurants and bars reopen, as regions 6 and 8 in northern Michigan and the UP have many of their restrictions lifted. We'll get an update from Dave Scott. The first night of bars and restaurants being opened was last night. They opened at 12:01 midnight on Friday. We'll get an update from Dave Scott from northern Michigan. But before we can get to any of that incredible information from those wonderful guests of ours, we have to kick off today with our first guest on the Megacast, on our family of stations, and on the West Bloomfield Clerk's Office's Facebook page. We'll begin today's show with the Executive Director of West Bloomfield Parks, Jennifer Tucker. Jennifer, welcome to the program.
Thank you. I'm sorry I had to unmute. I'm not used to that quite yet, even though we've been doing it for 12 or 10 weeks.
Yeah.
Thanks for inviting me.
Oh, glad to have you with us. You know, it's an adjustment. We're still all adjusting. There's so many new buttons we have to push and so many new things we have to do to navigate this technology in order to still be able to communicate and take care of business as usual. So it's been a while since we've talked with you last. How are you? How's your team at West Bloomfield Parks?
Fantastic. We are seeing a fantastic amount of park users, some new to our area, some that we have seen for years and years. And I was actually out on the trail yesterday. It was like a super highway, but that's fantastic. We want everyone to get out and use our trail, hiking, biking. It's all fantastic activities at this point in this strange situation we're in.
So as we start to come out of this process and restrictions are being lifted, what's going on at West Bloomfield Parks in terms of the day-to-day operations? At places like the Recreation Activity Center and places like our parks, is it still kind of a skeleton crew, or are people starting to come back to work from home?
So we, some of us are working from home, or a combination. As I say, I was in yesterday. Some things still have to happen. But our park maintenance is at full scale. We don't have seasonal help at this point, but all our full-timers are out keeping our park safe and clean for this, trying to keep up with this influx of folks that are really appreciating our parks.
So you mentioned seasonal help that you normally would have at this time of the year. That includes extra staffing for the heavier traffic at the parks. That includes a lot of camps that West Bloomfield Parks and similarly other parks organizations throughout Oakland County tend to have right around this time of year coming forward. Are the parks' camps at West Bloomfield still scheduled to continue? What changes may be going on with those?
Currently, we have not made a decision. Many other park systems have made that decision. We are trying to come up with the most creative possible solutions to some of these things that are going on. We're not exactly sure what that's going to look like, but as the governor comes out and continues to release and make new recommendations, the recommendations we get from Oakland County Health, we will continue to review that. And currently we're looking at, after that June 1 date, to revisit and to see if it's feasible to continue those kinds of camp situations.
So you mentioned earlier on that the weather's better. You're seeing a lot more foot traffic at your parks. It's great to know that people are coming back out and are enjoying the great parks around West Bloomfield, and hopefully in other areas. If you're not watching or listening to us from West Bloomfield, you're doing the same in your area of the county. Are any special precautions being taken by your team currently, or in partnership with the police department, as things begin to warm up and the stay-at-home order is lifted gradually, and to keep these parks safe and maintain those social distancing guidelines?
So we have been doing cleaning as we would. We have particularly high standards generally. Our restrooms are still not open. I know that the gathering has been up to 10 people, but if you know West Bloomfield, 10 people is not enough for us to open some of our bigger amenities, because it would just honestly it draws hundreds. So we definitely, our staff has personal protective equipment that they use every day. We stagger all our schedules. So we have a restoration plan in place. And so we're really conscious of that. I will say that shout out to the West Bloomfield Police. They have been phenomenal. As you know, people are in a state of, I don't even know what to call it, honestly. People are acting differently than they normally would. So we have had some, the West Bloomfield Police has been really great in helping us kind of mitigate those gathering situations. or any type of misuse situations. And we're so grateful to them. They are a fantastic partner.
So a lot of the larger facilities that you mentioned, like the ones that you have at Drake Sports Park or the Recreation Activities Center that have activity all throughout the year in normal times, those aren't open. Are any other facilities specifically open, or is it just the parks area necessarily at this time?
Just the green spaces and the trail are still open. And we know that it's very frustrating. I get a lot of requests for tennis, and what people just need to keep in mind, as soon as you open tennis, then you have to open pickleball, then you have to open the skate park, and all of a sudden we have 1,000 people in the park. And so it's more than just one activity. It's all of those activities together. How many people is that going to generate? And we just want to do everything we can to keep our residents safe and healthy and happy. But unfortunately, we're going to have to take a pause on tennis and pickleball until some of these restrictions are lifted a little bit more.
When these restrictions are lifted, if and when it happens soon, what plans does West Bloomfield have in place for something like pickleball or tennis to maintain social distancing, to prevent from having a long line and a large crowd waiting to play on the courts? Are you working on anything like a scheduling system, so to speak, for those activities when they are safe to reopen?
So for pickleball, our pickleball group actually does have a scheduling system that they do through Google, and which is fantastic. We do leave one court open for people that want to play that don't want to be in that scheduling system. So that situation will occur like it normally does, and it'll be just basically, when they want to play, they have to come and put their paddle in and get in line, so to say. So, but we do know that there's going to be an influx, but we are asking people and have put signage out to maintain those social distances. Think of everyone, including them, their partners that they have come with, and just make sure that we're doing everything we can to, uphold the governor's orders at this point.
In terms of cleaning those courts, Jennifer Tucker, Executive Director of West Bloomfield Parks, with that being the case where there are some scheduled facility uses in that situation with the tennis courts and pickleball, and there is a court open that is first come, first serve, how do you maintain, as West Bloomfield Parks, keeping those facilities clean, even though it's mostly people using their own equipment and they're not really interacting, hopefully, with too much of the fencing and the nets and so on? What is West Bloomfield Parks, and what are maybe other parks throughout Oakland County doing to keep those facilities clean?
So what currently we are doing, because we've had such a big influx of folks coming and enjoying the park, one day a week we are closing a park, so it allows our staff to move freely within the park and not have to be concerned that they are going to interrupt someone's morning walk or their, when they come in, read a book in the park bench. So from 7 o'clock to 11, the park is closed. We do what we do, like little park fairies, and get everything all spiffed up for our guests, and then we reopen the park. So currently that is what we're needing to do. Hopefully we will be able to, as things start to open up and people have other focuses like going to work in the morning, we may not see as many folks, and then we can not continue that practice. But until further notice, we are closing for about 4 hours once a week to make sure everything is clean and tidy.
The Megacast on the Oakland County Megacast on our family of TV and radio stations, and also on the West Bloomfield Township Clerk's Office's Facebook page today. We're joined by Jennifer Tucker, the Executive Director of West Bloomfield Parks. So one thing we're really fortunate to have in Oakland County is a lot of great parks throughout all these municipalities, and what makes them great is there's such variety that people can travel between communities. In West Bloomfield, one of the great parks that we have coming up, and still in the initial portions of being built and being arranged, is Splash Landing. Obviously, that's delayed by COVID-19. Any update on where that project is or when people in West Bloomfield and neighboring areas can expect it to be open and operational?
So yes, it's a mix of sad and happy. We did resume construction, and we are seeing some struggles with getting materials now. So honestly, at this point, I don't think that unless some miracle happens, that Splash Landings will open in 2020, but we will finish the project hopefully by the fall of this year, and then be able to open for spring of next year. That is what our anticipation is at this point. We're hopeful that, that everything starts to go a little smoother and we are able to get more materials and things are going to start coming back together. But boy, no one saw this coming. That's for sure.
Yeah, no, absolutely. Jennifer Tucker, Executive Director of West Bloomfield Parks. Nobody saw any of this coming. You mentioned earlier that as of now, your camp programs are on a waiting period as far as whether or not they're going to be in the works this summer. You have a lot of other summer programs that are traditionally going on around this time and in the coming months. Any programs that are in the works or any modified scheduling for your summer activities currently in the works as we enter this phase of our new normal?
So yes, we do have a couple things that we have already modified, and a couple services that we have started just to make sure that our folks are our seniors that are members of our Connect facility staff we do have a support line to them and to any senior in the community. They can give us a call and a staff member will call them back, whether that's just for a health and wellness check, or if that's just they have a question or, don't know how to use the, online grocery app, things like that. We're here to try to help in any way we can that is, within our resources. And if not, we can refer them to another resource that may be able to help. As far as programming, we do have a couple things that we're going to try now that we have a 10 and under limit. That would be outdoor yoga. We have a couple other programs that we've actually modified also, which is our curbside pickup for our native plant sale. That's on our website currently also. So all of these things are kind of hot off of the presses, and we're going to give it a go. Everything we've done to this point has sold out in 2 hours or within the day. So we know people are hungry to get out and recreate, and we're going to do as much as we can while adhering to those limits. So if anyone has any questions, please go to our website, www.wbparks.org, and definitely all our information will be on the website.
West Bloomfield Parks Executive Director Jennifer Tucker, anything else that you'd like to say or that we didn't touch on before I let you go?
Just stay safe and stay healthy. Our biggest drive is to make sure that our residents are as adhering to our social distancing and just keeping each other well. And so we really are appreciative of all of our first responders, and that includes our folks within the parks. Our staff is very dedicated, and we just want to make sure that they have we're all adhering to the social distance and having the best experience in the parks that we can at this point.
All right. Thank you very much for joining us, Jennifer Tucker, Executive Director of West Bloomfield Parks. All right. We will continue on with the Megacast on 89.3 Lakes FM, 88.1 WBFH, The Biff, and WAHS, 89.5 Avondale Community Radio. Also on TV, Birmingham Area Municipal Access Television and Civic Center TV, both of those community television stations. On Comcast, Channel 15, and AT&T, Channel 99. You can also watch all Civic Center TV programming, including full episodes, interviews, and clips from the Megacast on civiccentertv.com. Click on the Megacast link, and then you can click on whatever you'd like. Full interviews. You can rewatch our interview with Jennifer Tucker. If you missed the majority of that interview, you can watch that full interview later on in the day. We'll have all of our interviews from today posted today, so you can watch those throughout the weekend. You have clips from important moments from our past Megacast episodes, as well as any time that the governor has her press conference updates for the state. And talking to Jennifer Tucker, it's good to know that the parks are still fully operational. There's a lot going on at the parks, always, all the time. And you were out at a few of our parks, Erica Jones, with us in the studio earlier on this week. You went to, it's within Oakland Parks. It is their Oakland County Farmers Market, and you also went to Drake Sports Park earlier on in the week. People are out and about, and they want to recreate.
Definitely. I couldn't believe the amount of people that were at the Oakland County Farmers Market yesterday. It was honestly very refreshing to see, it felt normal being there. Of course, people had on face masks, but it was nice to just be around people, and everyone just had so much excitement for being there, and you could just feel the energy in, the farmers market amongst everyone. I also went to Drake Sports Park. I believe that's Farmington Hills.
No, that's West Bloomfield.
Oh, is that still West
Yes.
Bloomfield? Okay. The other day, and I was a little disappointed there. There wasn't
It's also
very
early
many
on
people
the day
there,
too,
but yeah,
and it was a little cooler, so.
as we just heard from Jamie Tucker, there has, they've noticed a lot of people in the park, so that definitely makes me, more optimistic. But maybe I just caught the park at a bad moment.
Yeah, it's probably just early on in the day, and some people are still waking up, getting out in the community, and of course they're watching and listening to the Megacast, so they're a little bit occupied at that moment. But people are going back out. There are restrictions being lifted on medical procedures and on recreational outings as well. And to talk about the medical aspect of all that, we are joined by one of our favorite people to talk to. We talk to him all the time on this show. Our medical expert, Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates. Dr. Taweel, welcome to the program.
Thank you for having me. Thanks very much. I don't know if I get the distinguished one of our favorite people to talk to, but
you are.
I appreciate that.
So how are you? How's your team?
Team's doing okay. Again, the office is open back up. It's a slow, limited role, so to speak, because we have to space out the appointments and trying to put it all together slowly. It's been a rough go. So far, so good.
At a press conference yesterday, Governor Whitmer announced non-essential medical procedures, dental procedures, veterinary services, and so on will be permitted again beginning on May 29th. Have you seen in your practice, or have you heard from other colleagues throughout the industry locally, any rush for people to schedule their checkups or schedule these appointments with their medical professionals?
I'm finding that people are pretty okay with doing a lot of the telehealth virtual types of appointments. People seem to like that because they're still concerned about going outside. They're still concerned about meeting with people. They're, trying to practice social distancing and are cutting corners where they can. And I think that they're very appreciative of that option. And so they're still using it. Now, that doesn't mean that I'm also getting a lot of people that are calling me for dental issues because they can't get in with their dentist. Like, I feel like my tooth is infected. Can I get an antibiotic? So then that ends up, I have to kind of practice a little bit outside of the box, write for antibiotics, for things like that, when they should be seen by their professionals. So I'm seeing people trying to cut corners here and there, and I have others that are just anxious to get back in.
And so on that note, if someone, people are still eager to do telehealth if they can, and some people really do want to get in and visit their doctor right now because they have a sore tooth and they can't get into the dentist or something along those lines like you mentioned. What are some of the cases where somebody should really look to schedule an in-person appointment versus a telehealth appointment?
Well, it's very difficult. I mean, some telehealth gives me everything but the actual patient, which can be a little bit difficult to diagnose. And sometimes through telehealth, things are vague. I mean, if it's something that's very simple, common cold, I feel like I have a urine infection, a rash that they can actually point to, that makes it a little bit easier. But if it's something that's vague, I feel like there's something here. I don't know quite what that is. Usually during those telehealth visits, I'm able to say to them, look, this needs to be evaluated a little bit more personally. Also, we want to be able to do a physical exam, vital signs, things like that. I want to check for lymph nodes, make sure things aren't popping up that shouldn't be popping up. If you feel like you're having trouble swallowing, the list goes on. So some things are simple that are telehealth capable, and some things aren't. And typically during those telehealth visits, I'll say, look, I think you just need to get evaluated. We need to kind of push this in a further direction.
So in those cases, some people may be hesitant to get back out and schedule their much needed checkups in these cases. They may have had telehealth appointments, and you say, I really need to have you in the office so I can check you more up close and personal to really get an idea of what's going on here. For people that are a little bit hesitant, what do you have to say to those potential patients who maybe are afraid of coming in for those checkups to ease their minds a little?
Well, I will, most importantly is to evaluate getting a story just to see if it's something that's dangerous. Is this something that needs to be addressed, or is this something that needs to be addressed right now? So I can usually say, look, this can wait a little bit, but I wouldn't wait too long. I'm not quite sure what this is. Here's the risks. Here are the things that I'm concerned about, and if we sit on it too long, this is what could happen. And if I have to explain that, and if the patient's willing to take that risk, then, I'm doing the best that I can. Now, there are scenarios where I say, look, this cannot wait. And I know that you are concerned that you might pick up something like COVID. However, the risk of that is outweighed by the risk of what I think you might be dealing with. You schedule a virtual appointment and tell me that you're having chest pressure, and I'm concerned that this might be a heart attack. I'm going to recommend that regardless of what your concerns are, you need to go to the emergency room. And I've done that on occasion with some patients of mine that unfortunately had symptoms that were a little bit more important than what's going on. And also bear in mind, emergency rooms have had very good plans in place to get people through them, as are doctors' offices. They have very good plans in place to get people through them with the least amount of risk of contracting COVID-19 if there happened to have been an exposure in that area. So, we're doing the best that we can. Some concessions have been made. There's some patients that we talked to and said, hey, again, this can wait a little bit. I usually get you in every now and again so I can monitor this, but I'm willing to let that go a little bit further, and everyone kind of gets it. So, but when things do get a little bit out of control, you have to explain to them that this is, unfortunately, you got to get seen.
In terms of risk reduction, with these restrictions being lifted, non-essential medical procedures are going to be permitted again on May 29th. Maybe that presents a little bit of a challenge for these doctors' offices that have seen some patients in person pop up here and there throughout this process, but now with more people coming in, what are some of the precautions that are being taken and those changes to get people in and out quickly but also safely that may have to be modified a little bit as more of these non-essential procedures come into medical offices?
So non-essential procedures coming into medical offices are going to get screened before they even come in the building. At least this is the plan in place at my office. You get screened before you walk in the door. If you have risk of exposure, if you have temperature, any types of symptoms that are listed from the CDC, then you get screened in the parking lot and you don't come in the building because we need to reduce that risk. And the non-essential procedure will get put on hold until we get a verified negative COVID screen, which we do. And that's how they're doing it for outpatient surgical centers. All pre-surgical patients typically are getting screened. You do not want a patient coming in and essentially contaminating an entire team that's working on getting procedures done. But these screenings are going to be in effect before people come in. Now, if people do come in, they pass the screening, those procedures will get done. For you coming to my office, you get past the door, so to speak. You end up with an appointment with me. We're all wearing personal protective gear, and we are, the patient's wearing a mask. I'm wearing a mask. We're doing the best that we can. After the patient leaves, they're going through kind of a flow. They used to come in and out the front door. Now they're coming in the front, out the back. Then we're now doing an entire cleanup of the room, sterilizing it from top to bottom, wiping everything down, and going from there. Patients aren't allowed to bring anybody with them. They have to come alone. So I'm having some problems with elderly patients that typically have people accompany them. Those are the ones that we're trying to reserve for video health calls if possible. And we've essentially closed the waiting room. So people have to wait in the parking lot, call before they can even come through the door. So these are all the small things that we're doing, and I imagine that they're doing that at other places as well. Seems pretty standard.
A lot of protections are being taken and a lot of precautions being made to keep people safe in these offices. In the event that, like we talked about earlier, someone has a telehealth appointment and you see something that you want to really, that you or another doctor, Dr. Jamie Taweel, may say, I want to see you in person. This is something that needs an in-person checkup. They come in, they get their screening, and they are showing some COVID symptoms. In terms of turning people away, what do you do in that situation? Where do you send them? How do you address that in terms of keeping the patient safe, but also keeping your facilities and your other patients safe from COVID?
Great question. So if you come to the office, you have something that needs to be seen, you get to the parking lot, you have tested, let's just say, for example, your temperature is elevated. Now you're at risk for COVID. So what happens is I do a swab, we test you on the spot. You got to go home and self-quarantine until something is, you go home, self-quarantine. I would recommend going to the emergency room if, let's say, for example, you came in because you were having the chest pain and I needed to see you. You got to go to the emergency room at that point so that they can better evaluate you and make sure that you're being separated from everybody else. And it's an important thing. Otherwise, I would send you home. I would wait until the test comes back. The test either comes back negative or you have to be 72 hours without symptoms before I would recommend you coming back through so that we can evaluate you. That's kind of where we're at right now. And if it's positive, then you're going to be asked to stay home until your symptoms go away for at least 72 hours and you are considered high risk. And you would basically stay home until this either blows over or your symptoms get so severe you have to go to the hospital.
And is that, at that point, is that a communication between you and the patient about what goes on going forward? And if they do test positive, but they still need that certain checkup, how do you communicate between your patient and between maybe a hospital or another facility that's ready to take a COVID patient for non-COVID related medical issues as well to make sure that they're getting the treatment that they absolutely need?
Well, emergency rooms are fantastic in terms of just communication. So if, let's say, for example, the patient had, we're going to keep using the patient that came in, he or she has tested or at least has symptoms that are concerning for me for COVID. And so they can't be seen, they have to go home, but they do have an issue that needs to get addressed. If it's something that I can address, then I will. If it's just a medication refill, but if they have symptoms that are more severe, I can't risk them coming in and contaminating the rest of the office. So I would probably suggest they go home until they're asymptomatic. If they do have something that needs to get evaluated, then they have to go to the emergency room. I'm not going to send a very simple case to the emergency room. I'm only going to send severe things, obviously. Mental status change, dizziness, chest pain, things like that, severe blood pressure issues. Otherwise, if they do have to go to the emergency room, then I will actually call the doctor, tell them that I'm sending the patient and tell them my concerns and coordinate that care with the physician. And they've been all very good about coordinating back with me. They usually call if they have further questions and so on and so forth.
So let's talk about masks now. People are going back out in the community. They are required in enclosed areas, and in many stores, such as grocery stores, are requiring people to wear masks when they're in the store. A lot of people may not be doing so effectively. Either they just don't know how to do it right, or there's just little things that they're maybe not catching. From a trained medical professional, in terms of wearing a mask, what is the most effective way? How should we be wearing our masks? And what are some common issues that maybe you see out on the town and how we can correct them?
Absolutely. Well, first, the most important thing is wear it. I have patients that are I see people just not wearing masks. Wearing the mask obviously has to cover the nose and the mouth. Please try your hardest to do that. A lot of people have been basically having their nose sticking out over the top of the mask. That is absolutely, it's as if you shouldn't be wearing one. I know masks are restrictive. I've already had patients ask me for, patients that feel that can really exacerbate their claustrophobia, so they don't want to wear one, and they're asking if it's okay to not wear one. I just, some cases I would just hope that they can try and get through it as best they can. You want the mask to cover both nose and mouth. You're trying to prohibit things from getting into your airway. This is a respiratory thing. So try to keep it, you don't have to make it so tight. The N95s need to be tight because they're particulate masks. They need to be able to, you can't let air get around it. It needs to be a tight seal because you're breathing through it. Other than that, they're doing the best that they can. Just please keep wearing it. Most people I've seen it hanging off the ear or around their, down here. It's becoming it's becoming interesting.
It is interesting to see people, particularly at red lights, where I just glance over, check my mirrors, and I just see someone in another vehicle over, and I look over and I'm like, oh, that's what they got going on there, and I see their mask around their neck as they're driving, because you don't need to keep it over your face when you're in your car, and it gets hot there.
Of course.
So you said that with the N95s, they need to be tight because they're trapping the particulate matter from getting in. And in terms of other just general masks, they can be a little bit looser. Is there any concern with that about particles from someone that maybe is asymptomatic getting out of there? What precautions should be taken in that situation?
I'm not sure I understand the question. Can you run that?
So like if someone's mask is maybe just a little bit loose on the sides, maybe. It's covering their nose, it's covering their chin. It's a little loose on the side. Is that a cause for concern? Should they be maybe using a different mask, or is that okay?
No, I mean, right now the CDC has recommended that cloth masks are acceptable. So we're basically trying to just prohibit that direct air, that direct exposure. So, N95s, I don't believe are necessary for day-to-day activity as long as you're practicing social distancing. I feel that N95 should be reserved for healthcare workers that are, actually dealing with COVID patients. Or healthcare workers that are seeing large volumes of patients to minimize exposure. I wear an N95 when I'm dealing with patients. But I think if you're going to go out and you're practicing appropriate social distancing, a cloth mask, as long as it's covering both the nose and the mouth, should be a sufficient way of reducing your transmission. Is it going to make it zero? No. But we're trying to slow things down, not prevent things. So I think this is going to be the best option that they can have. Obviously, wearing it so loose where it's allowing air to just completely get in, not going to be appropriate. But a lot of these cloth masks are not designed to be super, adherent to the face. They're just there to prevent, that direct exposure. So I think that unless you're wearing an N95, wearing it at least covering both the nose and the mouth should be sufficient.
So I'm wondering, I'm a runner and I go out a lot and I see people, and I'd say it's kind of 50-50. Some people, when they're on a run outside, will wear masks and some people won't. Personally, I don't. But what do you think? Is it necessary to wear a mask if you're by yourself on a run? What are your thoughts on that as far as safety?
That's a tough one to answer. If you're by yourself, you're not around people, your exposure is obviously diminished. But if you're running, I think, again, anytime you're wearing a mask, you're reducing your risk. So it should be beneficial to try and wear one. But if you're not going to be near people, your exposure is going to be pretty negligent. So I think it's a pretty appropriate thing to be able to not wear a mask when you're running, as long as you're not running directly across people where you're passing each other on those narrow paths. I think it should be okay. I do see people that are outdoors walking that aren't wearing masks, but at the same time, they're not near anybody. I'm catching them on the horizon, so to speak. So I think that I think it's okay to not wear a mask as long as you're not around people. But if you're in a situation, you're in an enclosed space, you're at a store, you're on a plane, you're doing things you're out and interacting, then a mask should be definitely necessary, specifically if you're going to be walking, downtown areas, things like that. But if you're just running in the park, I feel that you should be okay without the mask as long as, again, you're pretty much by yourself.
So Dr. Taweel, we've talked to you in the past, Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates, about the testing that's been increased, and we've seen antiviral research and antibody research and vaccine research also going on. We talked to you a little bit about that in the past. Have you heard any updates from local labs or from research facilities that maybe you're in contact with about the progress on these tests?
I'm hearing I'm getting reports that the testing is getting much more improved. There had been a higher risk of false positives with certain tests, most importantly the nasal swabs, but I'm finding out that false negatives. But I'm finding out that the newer antibody tests are starting to come through that are being a little bit more accurate, that are getting really, really accurate results and giving patients at least a better idea. So it makes contact tracing a little bit better. So I think that things are starting to pick up a little bit, and we're starting to get faster turnaround times on these tests, and we're getting more reagents. So these tests that used to take, up to 3-4 days, now we're getting pretty much almost 24-hour testing. There's even newer ones that are coming out that are pretty much 15-minute tests with a blood drop. I don't know how efficacious those are. So I'm going to reserve comment on those, but I do know that the antibody testing is getting a lot more improved. So I'm quite pleased to hear that.
Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates. Before we let you go, anything else you'd like to say? Anything else important that we haven't touched on that you'd like to speak on before we let you go?
No, thank you for having me, but I also just please stay safe. Continue to wear masks. They do help. They do work. We're trying to reduce this as best that we can. Any questions, always contact your doctor. If it's something that needs to be seen, they will let you know. So don't be afraid to get a hold of your doctor. You're not bothering them. That's what we get paid to do. And hopefully we can all stay safe out there. Any questions, I'm always glad to answer. So I appreciate you having me on. Thank you.
We appreciate having you with us, Dr. Jamie Taweel from Grand River Medical Associates, an internal medicine specialist, joining us on the Megacast. One of our resident medical experts. We'd love to talk to him about what's going on in the medical community, how doctors' offices are changing, and about, of course, research and testing so we can give you the best information that you need to know. We're not medical experts, so we talk to a friendly expert in the community that allows us to provide that information to you as best as possible. We're going to take a very short break. When we return, we will be joined by the Chief of Police of the City of Rochester, Steve Schettenhelm, on the Megacast. That coming up in just a moment. You are listening to us on our family of TV, radio, and internet outlets throughout Oakland County. The Megacast returns very shortly.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
It's the Oakland County Megacast on 89.3 Lakes FM, 88.1 WBFH, The Biff, WAHS 89.5, Avondale Community Radio on the radio side, on TV on Birmingham Area Municipal Access, or BAMA, on Civic Center TV in West Bloomfield, Kego Harbor, Orchard Lake, and Sylvan Lake, and on the Facebook Live of West Bloomfield Township's Clerk's Office, reminding you still have plenty of time to fill out your census. Go ahead and do that over this holiday weekend. Won't take you very long. It's about maybe 10 minutes. It's a really easy process. You can do it all online, and you can call your local clerk's office for any questions that you may have, and they will help you get to the resources you need to know so you can fill out your U.S. Census and help our municipalities throughout Oakland County, municipalities such as the City of Rochester, as we're now joined by Steve Schettenhelm, the Chief of Police of the City of Rochester. Chief Schettenhelm, thank you for joining us. Welcome to the program.
Good morning. Enjoy being here.
Yeah, how are you? How are your officers?
We're doing well. We've been, holding our own here. We have not had anyone that's been affected by the virus. Certainly taking a lot of precautions to make sure that continues to be that way, but we're doing very well. Thank you.
A very interesting background today on your Zoom. Is that in Rochester? Where in Rochester is that, maybe?
That's our downtown. We had some folks that came in and took some pictures of, they have a unique way with lighting and with our police cars. So those red and blue lights are from our police cars and kind of shows the light zooming down through our beautiful downtown.
It's very nice. And for those of you listening on the radio, I highly suggest going to civiccentertv.com later today. You can watch this interview with Steve Schettenhelm, Chief of Police in the City of Rochester, and see that beautiful picture as his background behind him. So we have a holiday weekend ahead of us. Are you expecting more people to be out and about in the City of Rochester? And how maybe is your team preparing for that given the circumstances of COVID-19?
Well, I think, we've had some good weather and that is always nice to see and gets people out and about. So we expect our parks to be pretty active, and our officers will be out as well, trying to make sure that people can enjoy a safe and pleasurable weekend here, those that stay home and stay safe.
In terms of the parks, we talked to Jennifer Tucker from West Bloomfield Parks earlier. She mentioned a lot of the facilities on the parks, such as the playgrounds, some of the sports courts, definitely the buildings are not in operation right now. They're closed. People are not permitted to be on them or inside of them. If people are going to the parks and have family of 10 people or more, a couple families congregating together and they're playing on the playground, what is the police in Rochester doing in this case to prevent that or to enforce the rules that are in place, and particularly in parks and other public areas as people go back out?
So our playground equipment and basketball courts are kind of roped off, so it makes access to those difficult, with the idea of making sure that we enforce the rule that playground equipment in Oakland County is not to be used, and to also help with promoting the social distancing so that we don't have that close contact. We really don't have, if you think about it, a way to sanitize and clean an active playground. So it eliminates that as being a concern for our young people for sure. We still have a lot of people that enjoy the park, walking and spreading out. And we've seen a very great voluntary compliance among most people that enjoy the park. They stay separate, stay within their unit of folks that share the same house. So regardless of how many, if you share the same home, you're able to stay together regardless of the 6-foot distance. But I think overall people have been very respectful of the social distancing, and we certainly appreciate that. It makes it safer, and it certainly makes our job easier as well.
It's good to hear that in the city of Rochester that people are following these social distancing guidelines and they're wearing their masks and they're complying. We heard similar good news last week from the city of Keego Harbor, and we've heard from other municipalities and police departments locally that a lot of people in Oakland County are doing their best part to follow these distancing guidelines and to wear their masks, and it's always good to hear that. So as people get back outside and as the weather gets warmer and businesses start to reopen, what assistance is the police department in Rochester providing to local businesses, to recreational areas, and even to individual civilians or families necessarily, to help them prepare for more people being out and about?
Well, we've provided, we've had access to some masks and things of that nature. So we've help particularly our seniors with access to that kind of equipment, if you will, so that they can help keep them safe. We've done some work with obtaining hand sanitizer and that, and helping mostly our senior population that need it. So we've kind of been helpful in those ways to try to help support, and a lot of it is just some advice. People call and ask us, about the different rules and regulations and how the virus is transmitted, and are just looking for someone to talk to and to kind of counsel them, through the process. And we answer the questions that we can, and we know where to advise them to look for the answers that we can't. We've also been working with our Downtown Development Authority, also again on the side of safety, and providing them with some equipment and also facilitating them to resources so that they can help our businesses. Because as with the most recent governor's order, we're trying to get closer and closer and closer to them being able to restore to full business operations, and we want them to be ready to go, and we want it to be safe when that day comes.
Stephen Shettenhelm, Chief of Police in the city of Rochester, joining us on the Megacast all throughout the Oakland County area and on Facebook on the West Bloomfield Township Clerk's Facebook page via Facebook Live. So we talked previously with other chiefs of police throughout the Oakland County area about the rules that are in place for individual businesses to enforce social distancing and mask wearing, and what actions that they can take in the event that someone is refusing to comply. If someone isn't complying, they're not wearing their masks, they're not keeping their distance, what can civilians do, what should businesses do, and what will the authorities do in those situations?
Well, if we receive a call, we will certainly go out and investigate, and our goal is always to obtain some type of voluntary compliance, to inform them of the concern, and hopefully make them appreciate the apprehension that someone may have if they are not respecting the social distance or not wearing a mask and that sort of thing, and certainly help to make that a better and safer situation. Individual businesses, they certainly have, as a private property situation, they can request that someone wear a mask and then choose to allow them to provide service to them or not based on, how they feel about that situation. Some businesses may have a supply of masks. I know that I've heard of places where, come on in, it's $1, here's a mask, and we'll keep everybody safe. There's a lot of ways to work this out and keep everybody safe and continue, as business continues to open. We certainly want it to go smoothly and safely.
And in terms of what civilians can do, that they're not the business owners, they're just John Smith and Jane Doe going to the grocery store, going to a park, and they see people that are not keeping their social distance and they're not wearing their masks. Is there anything that these civilians can do to either help the local law enforcement or what they should be doing in those situations to try to help up the compliance in the local area?
Well, I think, I certainly we don't recommend that people take matters into their own hands. For some folks, it's a pretty emotional decision whether they decide to wear one or not on both sides of that equation. So you can certainly, contact your local police department if you see something that you think should be looked into. Consult with a manager at a store. But I think, if the thing that we try to urge people is keep in mind that the reason that they're social distancing is for you to also keep your distance. So when we have situations like that where someone chooses to go and engage with someone who may not be wearing a mask or is not socially distanced with someone else, in a way you're putting yourself in harm's way, and we can leave that to the management of a facility or the police department in those situations. So it's sometimes better not to interject yourself in what can be an emotional situation and also get you involved in a situation where your safety is compromised as well.
Chief Steve Schettenhelm from the Rochester Police Department with us on the Megacast. Before we let you go, anything else you'd like to say? Any other words of advice or wisdom for the people of Rochester and the Oakland County area as we head into this Memorial Day weekend?
Well, we do appreciate everyone's patience out there. We know that, this has been some trying times for sure. But, we constantly see and we're gratified by the people reacting properly, using good judgment. And we just hope that people don't get complacent. And, we're going to see the numbers where our efforts are showing when we look at the numbers of people that are coming down with the virus. So we're making progress, but we're going to continue to make progress by people adhering to all those tenets of safety, wearing a mask, making sure you're keeping socially distant, keeping up on your hand hygiene and things of that nature. So I think, this is a long stretch, and I'm confident that people will respond appropriately and will keep flattening the curve, as they say.
Well, as it looks right now, as we've seen, as been reported from law enforcement and EMS throughout our communities here in Oakland County, we're on the right track. Chief Stephen Schettenhelm from the City of Rochester's Police Department, thank you for being with us today.
Thank you very much. Appreciate it.
Watching and listening to the Megacast on our family of stations. We're going to take a short break and head right on in to the second hour with plenty of great people to talk to coming up. Dr. Melanie Schwartz, Rabbi Daniel Schwartz, Erin Finn, Olympic hopeful from West Bloomfield and the University of Michigan. And we'll check in with our very own Dave Scott from Northern Michigan. That coming up and more on the Megacast on our family of TV, radio, and other media outlets.
Faust, the medical director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6. If you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
The Oakland County Megacast on our family of local community media outlets on Civic Center TV, Comcast Channel 15, AT&T Channel 99 on the web, in high definition on CivicCenterTV.com. On Birmingham Area Municipal Access, also on Comcast Channel 15 and on the AT&T Government Public Access and Education Television Guide on AT&T Channel 99. And on our family of local community radio stations, 89.3 WBLD Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake, 88.1 WBFH Bloomfield Hills, and 89.5 WAHS Auburn Hills, better known as WAHS 89.5 Avondale Community Radio, with superstar student radio professionals such as Logan Pizzurro, our engineer over there on this and every day of the Megacast, Monday through Friday, 10 a.m. to 12 noon on our family of stations and on our Facebook partners. Today, our Facebook partner is the West Bloomfield Township Clerk's Office, encouraging you to fill out your 2020 U.S. Census. It affects your municipalities for the next 10 years in terms of funding, especially in times of emergency like we're in right now. It's as easy as going to 2020census.gov and just clicking on a few buttons, responding to the survey, and it is safe information. Your information is not going to be given out by the Census Bureau for 72 years. So take some time this Memorial Day weekend and go fill out the U.S. Census. Help your municipalities and help our good friends over at the West Bloomfield Township Clerk's Office and other clerk's offices in the local area here in Oakland County. Also on the web on CivicCenterTV.com are headlines for today and every day. We update this regularly to bring you the latest information from around the state of Michigan and the U.S. regarding COVID-19 in Oakland County. Making news today, Judge Cynthia Stevens tosses the legislature's lawsuit over Governor Whitmer's emergency powers. Judge Cynthia Stevens from Michigan's Court of Claims declared the governor's actions legal under the Emergency Powers of the Governor Act of 1945. She did, however, side with the Republican opposition in the legislature, saying that the governor did overstep her powers under the Emergency Management Act of 1976 in redeclaring a state of emergency in late April without support from the legislature. I gotta personally doubt, just my knowledge of this story and where I see this going forward, that's going to be at the end of it. We'll see. It depends on what the next actions from the governor are and what actions may be taken by the legislature. But in the case that we're speaking of here, Judge Cynthia Stevens had even said at the end of the last case she expects this to be looked over by her big bosses, referring, of course, in that case to the state Supreme Court. So stay tuned and keep watching CivicCenterTV.com/coronavirus for that latest information on that story. Making big news yesterday at the beginning of our program, the governor, Gretchen Whitmer, announced that she is lifting portions of her earlier stay-at-home order and reopening parts of Michigan's economy. People will be allowed to engage immediately in social gatherings of no more than 10 people as long as they continue to adhere to social distancing guidelines and wear facial protections in enclosed areas. Retail businesses, auto showrooms will reopen on May 26th, those by appointment only. This does not, in that case, include bars, dine-in restaurants. In addition, we talked to Dr. Jamie Taweel earlier on in the show and talked about non-emergency dental services, non-essential medical procedures, and veterinary services will be able to begin again on May 29th. Still, nothing in terms of gyms, theaters, libraries, bars, restaurants, and other public entertainment facilities as of now. Could hear more on that in the coming days and weeks from the governor, and we'll have those press conferences for you right here on 89.3 Lakes FM and Civic Center TV and on our family of stations as that news comes in during this broadcast here on the Megacast all throughout Oakland County. And as things change, so does people's mental health. It goes with what's happening in our society, and to talk about how those changes affect people, we are joined by our resident psychology expert, Dr. Melanie Schwartz from Viewpoint Psychology and Wellness. Melanie, how are you? How's your team?
I'm good. How are you?
Doing well over here. The weather is improving. People are starting to get outside more. Do you foresee that that's going to help improve people's mental health?
Yes, absolutely. I'm seeing it just based on the weather, the extreme weather changes we have day to day lately. And people's moods are really dependent on the weather right now. And on the days where people are able to get outside and either sit on their, porch or deck or go for a walk or go for a bike ride, their mood is significantly improved versus the days where we're stuck inside because it's pouring out and it's cloudy and it's not a great environment to be outside in.
If people are more concerned about going back out into the community, grocery stores, going back to work, going to certain areas like parks, do you encourage them still to go outside and get some activity? How can that maybe help them through this as we continue to slowly but surely move out of this pandemic?
I think it's baby steps right now. As people's anxiety is going up, as we are moving towards having to get back into society and go to grocery stores and go back to the office and things like that. I think it's baby steps. Go outside, see what's going on around you. For somebody who's been, cooped up in their house for the last 10 weeks and hasn't left, they don't even know what the streets are like or, what the environment around them is like. So start small, just go outside, get some fresh air, see what's going on, go, maybe even just go for a drive to see what the streets are like, if they're busy, what the stores are like right now, and just get a sense for what's going on. And that will help you have a little bit of control over the situation and prepare you for what you need to do.
In situations where people's mental health or their state of mind regarding what's going on in the world right now and how things are changing, if their outlook is maybe not as, pun intended, sunny in this case, how can people ensure that they are able to reinforce, or how can they strengthen their mental health as things ramp back up and people become more anxious to leave their homes?
Self-care, through this whole thing, it has been extremely important. Take care of yourself, keep a routine, stay in touch with people, make sure you're communicating with friends and family, making sure that you're getting sleep, making sure you're eating, talking to somebody, talking to a therapist if that's what's needed right now in order to help get you through your depression or anxiety or grief or trauma that you're experiencing right now. And just all around taking care of yourself. People are kind of not doing that right now. I'm seeing that a lot in my practice. They're not sleeping well, they're not eating, there's no routine. They're staying inside, they're not getting out. So making sure that you are doing those things, because it makes a big difference on your mood.
What kind of role does exercise play in this too? Because I've noticed that when I have days where I come into the office here, I do my work, and then I go home, that I feel significantly different than on maybe some days like weekends or days that are shorter here, where I get out and I play some basketball, I go for a nature walk. How does exercise play in? Does it help people improve through these situations? Does it make their days maybe better or help them through these mental health issues?
Absolutely. It makes it a huge difference. I know that myself and my therapist at Viewpoint, we are recommending that even if you don't do it daily, a few times a week, it is extremely important. It elevates the mood. It helps with the chemicals in the brain and just all around makes you feel better. I know I've been going for daily walks outside, whether sometimes when it's raining as well, just to get outside and get moving and get some fresh air. It makes a significant difference in your mood.
It does, and I've noticed that the better days that I have are when I'm out and I do a nature walk, or I go and I play some basketball. So it does help and improve that, and there's a lot changing that around us that can kind of put you in flux. So anything that you can do to help improve that mood, you really should be doing.
Yes, and I'm seeing a lot of people out there. I mean, when I'm out walking, or I see my neighbors, I see people on their bikes, I see people running. It makes a big difference. You can see it on their faces. You can feel it physically in yourself. You can feel it emotionally. It just makes a huge difference and very important right now.
So we saw plans earlier on this week. Big news earlier on in the week was that West Bloomfield schools laid out their plans for the upcoming fall semester. And it looks like the new school year normal, the new normal in our schools is going to be a lot different than what we've been used to seeing. People are going to be kind of bouncing from in school, possibly, at least in this case, and being back home, some virtual, some in person. As we approach this new normal and how it may be going away for the next fall, this surely is going to have some psychological effects on students, on staff, teachers, and parents. What do you imagine these drastic changes may be having as far as an impact?
Well, it's going to be quite the adjustment. Like anything else, we're going to still have a routine. There's going to be some consistency. People will adjust to it, not without anxiety or frustration, or maybe some hopelessness that the pandemic isn't going to end. But I do think that people will adjust. I think, the more routine that the schools can provide for us, the better off that the students will be, as well as the parents, just so we can prepare for what that's going to look like. But in the meantime, right now, I know parents, not so much the kids, but the parents are having a lot of anxiety as far as preparing for that in the fall, myself included as a parent, just not knowing and not knowing what that's going to look like, and just trying to plan or prepare how we're going to live our lives that way. It is increasing everyone's anxiety right now. But as the fall comes and the plans are put in place, I think people will feel a little bit more secure and their anxiety may go down a little bit. But I think routine will make a difference.
As people mentally prepare for those changes in schools, in the workplace, are there any strategies that teachers, that parents, that students can start employing now that may help improve those changes as they adjust to them come the fall?
It's really important to take things day by day right now. We're focused on the future because that's what we're trying to plan for. However, it doesn't help us right now because we're not there. We can't do anything about it. So it's really important right now to just focus on day by day, sometimes hour by hour right now, and not try to focus on the fall. Let's try and focus on today, or summer's around the corner, and what that's going to look like rather than 3 months from now. So that would be a major strategy right now. Also, some security that you have to remind yourself that the schools are going to do what's best for us, and that they're going to take care of their students. They're going to assist the parents in this transition, and that we're not going to be alone to just deal with this on our own. They're going to support us through this, and reminding yourself of that. Those things will help make a difference right now.
Dr. Melanie Schwartz joining us on the Megacast on Civic Center TV, 89.3 Lakes FM, Birmingham Area Municipal Access, 88.1 WBFH and WAHS, 89.5 Avondale Community Radio. Dr. Melanie Schwartz from Viewpoint Psychology and Wellness. Just a couple more minutes with you, Dr. Schwartz. Is there anything else that you'd like to say, or maybe we haven't touched on, that you think is important to speak about today?
I think right now we've had such a difficult 10 weeks, I really think it's important to try and incorporate some fun right now. People are feeling the grief of their summers looking different than they expected. And so I think there needs to be some brainstorming right now to figure out how you can enjoy your summer, even though it's going to look different than what you expected it to be. Of course, I want you to feel your emotions and talk about them and experience them, whatever they are. But I think, we've kind of let go of we've been so focused on negativity and what this has done to us, rather than how are we going to get through it and in a way that can be positive and still enjoy our summer. We're just going to have to brainstorm and look at it a little differently than we have in the past.
Just going back to the school's decisions, real quickly, do you think that to some extent it's almost too soon for schools that don't start until September to be making definitive decisions as to what they're doing, just in the sense that it could cause, more anxiety for students and parents, knowing right now that the schools plan on having things be abnormal? Or how do you think that's affecting mental health with the plans being made so soon?
I think it's doing a little bit of both. I think, number one, the schools have to work on it because they need to have a plan in place. And I think they're making their decisions based off of, expert information. So in that sense, I think that gives us a little bit of a sense of control and decreases our anxiety, but also not knowing is going to increase our anxiety, and just thinking about what that could look like is causing anxiety. So I think it does a little of both. Either way, I don't know that there's one way that's better than another, because I know people are questioning it and asking, and they want information, and their anxiety is there if they don't have the information. But then once they get the information, that's also causing some anxiety. So I don't know that there's a one solution that's better than another in this situation.
Dr. Melanie Schwartz with us on the Megacast. Before we let you go today, anything else that we haven't touched on that you think is important to talk about, or anything else that you have to say?
I think just, I've said it before. If you are struggling right now, get in touch with a mental health professional. We are here. Viewpoint is open. We are accepting new clients. One thing to know is that a lot of the insurance companies right now are paying for everyone's copay and deductibles, and that's a huge benefit right now. And people should be able to take advantage of that, and should really look into that, because if you need it, it's free right now. And that's not often a luxury that we have. So take advantage of it. If you're struggling, if you're feeling anxiety and it feels like it's out of control, or you're feeling depressed, or you're feeling grief or trauma, get some help. Reach out. We can help you.
Well, thank you very much. We appreciate your consultation. I'm sure our audience does as well on the program. Dr. Melanie Schwartz, thank you for being with us today.
Thank you very much.
She is Dr. Melanie Schwartz from Viewpoint Psychology and Wellness with us on the Megacast, on our family of TV stations and radio stations, Civic Center TV and Birmingham Area Municipal Access Television, 89.3 Lakes FM and lakesfm.com, a service of the Greater West Bloomfield Cable Communications Commission, 88.1 WBFH, The Biff, a service of the Bloomfield Hills School District under the leadership of Ron Whittables, and WAHS 89.5 Avondale Community Radio, that a service of Avondale Schools. And today, as always, our engineer over there, our student engineer, is Logan Pizzuro. And that makes up our Megacast family of stations on a regular day. And on Facebook, we have a partner every single show. Our Facebook partner today is the West Bloomfield Township Clerk's Office. So to Debbie Binder and her entire team over there, we thank you for helping us spread the good word throughout Oakland County and keep the people informed as we continue through this coronavirus crisis, and speak to a number of guests about the issues in Oakland County and things that you need to know in your hometown, whether that be West Bloomfield, Rochester Hills, Pontiac, Auburn Hills, Sylvan Lake, wherever you may be in Oakland County, we have news just for you that you need to know. And I assure you that we don't have a requirement in the second hour of this show today that your last name has to be Schwartz to be on the program with us. We had Dr. Melanie Schwartz on previously, and now we'll be speaking to Rabbi Daniel Schwartz from Temple Shir Shalom in West Bloomfield. Rabbi Schwartz, thank you for being with us.
Oh, thanks for having me on again today.
We enjoy having you with us. How are you? How's your congregation? How's your family?
If you see the screen, you can see my son decided to join us as well.
Yeah.
And but everybody's doing great. Looking forward to moving forward and doing well.
That's good to hear. Are you still, is Temple Shir Shalom still running virtual services? Are you having more in-person, any plans for in-person services coming up?
So we're still doing everything virtually. Our Shabbat services, our classes, our study sessions are all virtual. At the moment, we don't have plans to open up and be in person for services or for most of our programming as well. We've got a task force that's been put together as we're getting ready for different things, but it still seems to be a ways off for us.
And with that, I thought about this morning. I thought about a lot of different rites of passage. We talk about graduation a lot with the schools. In terms of Jewish rites of passage, I think about most notably bar and bat mitzvah ceremonies that are going on with our local teenagers. How have those ceremonies been impacted by COVID-19? Are those virtual as well? Have those kind of been suspended? How's that working?
So every congregation is a little bit different, and every family chooses to do something a little different as well. So we had between March and June, probably about 15 to 20 different 13-year-olds that were going to celebrate their bar bat mitzvah ceremony, the first time that they're being called to lead the congregation in services and read from the Torah, from our sacred scriptures. And we have our first one actually since we went virtual at the beginning of March, that is coming up this weekend, and it will be a virtual bar mitzvah as well. So everybody will be at home. Our bar mitzvah boy is going to be leading services from his living room. Our cantor is going to be in her living room. Us rabbis will be in our living rooms as we lead services together, and we call him up to read from the Torah for the first time. Most of our families, though, decided to postpone their simchas, their celebrations, to later on in the fall, when we would be able to be together in person, hopefully, and to be able to celebrate with others too, whether that's a small intimate group or a little bit larger, depending on where we are with things.
I grew up I've always been a member of the Shir Shalom congregation, so I know even aside from, bar and bat mitzvahs, how important it is just for younger kids too to have their, Sunday school every week, and that's just such an important part of, growing up in a Jewish community. So how has that, been a virtual thing? Is Sunday school still up and running, or how are we doing that now?
Excellent, Erica. It's great to hear your voice. When they said Erica, I didn't realize which one, and now I know who you are and why your dad texted me earlier. So it's good to hear your voice.
Yeah, you too.
So for us, we've been virtual. We've been online for our Sunday school program as well, for our high school program. We continued with so really pre-K through 12th grade, we've been online for these last number of weeks on Sunday mornings and Sunday evenings. And the high school students, many of them have commented that it's really the highlight of their week, that for them, school, they might be online for an hour with some other people at most during the week, but most of their assignments are given to them and they're doing them on their own, and they're finishing within a few hours and have a lot of free time on their hands. And so to be able to gather virtually with peers to have conversations of depth has been a highlight for many of them. And with our Sunday school program in the morning as well, we've continued virtually, where we join together for our service together, and then they break off into smaller groups in classes, whether it's to play some games together with their peers or to have some time with their teachers as well.
So we talked earlier on in the weekend, we mentioned this earlier on in the interview, we talked about churches reopening and beginning their services. We talked to Monsignor Gary Smetanka from the Archdiocese of Detroit about some of the processes that they are going through as they reopen churches for services on Sundays and throughout the week for Mass. In terms of Temple Shir Shalom, we know you're all virtual. You're going to continue to do that for a while. Are there any preparations that are being made or any plans being discussed for if and when Temple does return in some sort of form to in-person services?
Yes, we've had a task force that has been put together by a number of key constituents, including a number of medical personnel that are in our community, doctors, nurses, social workers, mental health professionals that are part of this as well, and looking at best practices for when we do open. And so we have a number of different things that we're looking at in terms of trying to figure out what are the next steps for us. So even our office, everything is remote right now. And so that will be one of the first things that probably opens up, that will make sure the staff can come in and really run Temple in an efficient way. Shabbat services, our worship, our Sunday morning minyan that meets, those will be a part of the discussion as well. Our religious school programs, our preschool summer camp program, that every one of those we have committee members and our staff looking at trying to figure out what are the recommendations from the CDC, what are the recommendations from the Oakland County Health Department, and what are our own personal experiences and where people are and what they're going to be up for and what's going to be safe for them to be able to engage in. So we'll roll out different phases for us for opening Temple and the different programs that we have that will take a while, but we're going to do it in the safest way possible.
Rabbi Daniel Schwartz from Temple Shir Shalom in West Bloomfield joining us on the Megacast. Rabbi Schwartz, before we let you go, anything else that we haven't touched on that you'd like to speak about, or anything else that your congregation or the community would be helpful to know?
Well, I was on a couple months ago when we just started this with you all, and we were talking about what best practices were and what we should be doing. And, fortunate that the Jewish community, I think, took steps early on, even prior to our governor signing the executive order to take steps to not do things in person and to minimize the number of things. And there was a quote, I think it was from somebody from the CDC, that even though there's things that we can do, it doesn't mean that we should do today. And I think that's the motto that we're using at Temple as well. And I hope that people think about as our doors open and we're allowed to gather in small groups, that there are things that we can do, but is it the best thing for us to do as well? And that making sure that we're preserving life, safety, health of others, and not just thinking about our own needs, but the needs of our community is an important factor going forward.
Just, one final thing, and I don't know how directly involved you are with this, but what are your thoughts on birthright trips being canceled this summer, for Jewish college students or that have been anticipating that for so long, and as that's such a big part of just, finding your faith as a young Jewish person, do you think that's been hard for a lot of people, or have you heard about that?
But it's been difficult for a lot of people. All the should have beens, the could have beens that we've had over these last 2 months, that we actually had 2 trips to Israel from our congregation that were canceled. One was an adult mission this past spring, and then in partnership with other congregations, our federation and our local Jewish summer camp, Camp Tamarack, partnering to go to Israel this summer with 120 teens from the Detroit area. And I was one of the rabbis that was going to be leading that trip. And it's disappointing. It's sad when we have to cancel things like that. But when it came time to make the decision in terms of the safety of all the participants and what we would be allowed to do, once we got to Israel and to experience things, it was a pretty easy decision to be able to make. There's disappointment, there's challenges. We've tried to give people ways to bring Israel to us since we can't go to Israel. So we currently have a tour guide from Israel that meets with us on Tuesdays for a Lunch and Learn series that is open to the community, and we're traveling to different places. So it's not the same thing as a birthright or a teen mission or a family educational trip or a private tour of going there. But it's the next best thing that we can provide. And we look forward to when we're able to safely travel there and bring groups and to experience those things. And that will be part of that birthright experience for those 18 to 26-year-olds and having that, and look forward to engaging them in a safe way.
All right, well, Rabbi Daniel Schwartz from Temple Shir Shalom, thank you very much for being with us today. We appreciate you coming on.
Thanks for having me.
Rabbi Daniel Schwartz from Temple Shir Shalom with us on the Megacast on our family of TV and radio stations and on the Facebook page of the West Bloomfield Township Clerk's Office. We are going to take a very short break, and we will come back with news from northern Michigan. We have Dave Scott in Charlevoix, and he's going to give us an update on what's going on in the reopening regions. He's going to be around our bars and restaurants. He's got the inside scoop. That next on the Megacast.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
The Oakland County Megacast on Civic Center TV, Birmingham Area Municipal Access, 88.1 WBFH, 89.3 WBLD, Lakes FM, WAHS 89.5, Avondale Community Radio, and on the Facebook page of the West Bloomfield Township Clerk's Office via Facebook Live. Tyler Kieft, Erica Jones in the studios at Green Media Center at our flagship TV and radio station here on the Megacast family of stations. And joining us live now from Charlevoix is our general manager and host of the Megacast, Dave Scott, from Northern Michigan. Dave, what's been going on up there now that restaurants, bars, and so on are reopened?
Well, Tyler, thank you for having me on. I just want to make sure, can you see me and hear me okay?
We can see you wonderfully, and you sound fantastic.
All right, very good. Well, I am on Bridge Street in downtown Charlevoix, and it's a little surreal. Normally on Friday before Memorial Day, it would be a little bit busier, a little bit crowded, but people are pretty happy right now because restaurants are open. People are being served. Now, I'm going to go into the Villager Pub in a moment, but I just am going to walk around out here. There are people on the streets, and if you would allow me to adjust my camera, I will see if I can do this. So now you can see the scene in downtown Charlevoix, again on Bridge Street. If you can look off in the distance, there are people here in town. You can see the city has put cones on the street here for social distancing. And I don't know if you can see it way off in the distance, but the legendary drawbridge up here is up. So for the most part, there's boats down there in the marina. You might be able to see that. And people are active, but there are not that many. And, you know, that's good because most of the people from downstate, I don't think they're here. And I think that the people here in Charlevoix are just fine with that. In fact, mainly what I'm seeing is faces and names and people that I recognize here in the area. So you can see people are pretty happy, pretty joyous. A bunch of people in front of the legendary Villager Pub in Charlevoix. They are open, they are happy, they are dining here on the streets in downtown Charlevoix. So let's walk in now into the Villager Pub and social distancing, definitely. We got a couple of people over here. There's Jody working behind the bar, doing a really good job. Another patron right over here. Group of folks in the back, so it's not too busy. Tyler, I kind of wonder what it's going to be like, though, when the weekend crowd gets here. It's still a little bit early.
Have you heard any word from people at the Villager Pub or other restaurants? Have you spoken to them about what plans they have in place, maybe for when things do get busier, potentially later on, and how they're going to keep people distant and enforce these rules?
Well, I'm standing right next to Terry Leff, the owner. He doesn't really want to come on camera, but Terry, we're looking at your establishment right now. What do you think is going to happen this weekend when you get a little bit busier?
I think it's going to be crazy busy.
Are people, do you expect people are going to social distance, do the things that they need to do?
I think it's going to be very difficult.
Well, did you hear that, Tyler?
I heard a little bit of that, not much.
He said he thinks it's going to be very difficult this weekend. Jody is here. I'm going to walk behind her bar. Now, in all the years I've been here, and I know Jody pretty well, She's never let me walk behind the bar. Say hi, Jody.
Hello.
Tyler, can you hear Jody?
Yes, we can hear Jody just fine.
Jody, I see you have your PPE on. Tell me, what is it like first day opening of the restaurant? People all over the state of Michigan want to know how you feel and what do you think?
I'm a little anxious and scared, and we'll just see how it goes. We'll take it day by day.
You look good in your PPE. Where'd you get the mask?
Amazon.
You got it
Made in
online?
America.
All right. I can see your patrons right now are doing a good job of social distancing. How's that going?
So far, so good.
All right. What would you say to other restaurateurs who are watching in Oakland County right now? They can't open up down there. You're open here. What would you say to them?
Take all the safety precautions you can when you open, and try to bear with it. The new world.
All right, Jody, thank you. Good luck with everything. We wish you. One final question. You know your patrons here at the Villager. You've worked here. I won't ask how many years, but I know you. I know you've been here for a while. Are these people mainly local people, or are these faces from people that have come up from downstate? Do you think?
Right now, it's all local people that are in there at the moment.
You know, and Tyler, that would make our good friend Dave Lorenz of Travel Michigan very happy,
Yes, it
because
would.
on the show yesterday, he said, you know, we don't want a bunch of people from northern Michigan or from downstate coming to northern Michigan. Hey guys, real quick, are you local or are you from downstate?
Oh, no, we're here.
There you go. Yeah. Yeah.
This group has been together over 30 years.
All right, Tyler, this group that we're looking at right
Wow.
now has met here for 30 years, and they couldn't get together until today. So they are so
That's
happy
fantastic.
to be here and be able to get together. And, you know, why I wanted to be here to tell this story today is because I had to be here anyway. But I wanted to be here to tell the story because it is a great story. We have locals, not too many people from downstate. They're getting together. They are safely enjoying their meal, keeping their social distancing as they can. See, here's a couple gentlemen out on the street with their masks. And Tyler, it's all working. It's working out really, really well from Charlevoix.
That's good to hear. Erica Jones is with us too in the studio. Erica, you had something to ask of Dave.
Yeah, well, first of all, Dave, I'm incredibly jealous of you. You know, we kind of switched places today. You're out in the field and I'm in the studio. I got some big shoes to fill now. But how does it feel personally just to be in a restaurant for the first time? Have you gotten the chance to sit down for a meal yet and be served? Or just what's going through your head and everything?
Erica, you know me. I am all business, all work. I wouldn't think about taking time for a personal meal of my own. But I will later on. I got to eat. And I want to support the restaurants here in Charlevoix. I'm really excited. When I heard the news, I was very excited. I fortunately have a place here in northern Michigan in the summer. So it was okay under the governor's order to come. I was even more happy to be here to be able to share this story with you. And again, what we're seeing here, I think would make the governor very happy. It's mainly local people. The businesses are open. I'm about to walk to the clothing company right now. The doors are open. Retail is opening, and it's working out really well. You know, I mean, I think it's all going really well. So yes, I'm happy to be here, and I'm going to flip the camera around if I can. And you can see. Can you guys see what's going on here?
We don't see it just yet. I'll stick with you for a bit. We're not seeing your video. Looks like we may have lost Dave. We'll stand by with him. See if he comes back in just a moment. But that's Dave Scott from our team in Charlevoix in northern Michigan, giving a report from on the ground as restaurants, bars, local retail establishments are reopening and are permitted once again to be under their normal operations. And it's interesting to see. It's interesting to see definitely how things have been going there. We do have Dave back. We'll just wait a quick moment before we go back to him on the ground in Charlevoix. Very interesting report. Great to see a heartwarming story from the Villager pub there. Dave is back. He's in a clothing store. Dave, we have you again.
Yes, my phone rang.
That's okay. Happens all the time.
So this is one of the retail establishments here in Charlevoix. Let me just ask this gentleman. We're live on the radio and TV in Oakland County. Do you mind if I ask what your name is?
My name's Cole.
Cole, I can't shake your hand. We can elbow bump. We have our masks on, so are most of the people here, Cole, do you think they're local, or are they visitors who have come up here from downstate?
I think we get a good mix. So.
Right, but the people that are here today, and your local patrons probably.
We're starting to see some tourism rolling.
All right. So they're starting to see some people, but Tyler, take a look. Again, I think the governor would be really happy here in this retail establishment. Very good. What do you think, Tyler?
It looks really good.
Social distancing.
It does. It looks great. The Friday of Memorial Weekend in a shop in northern Michigan. That's usually a time where it's packed and people are keeping their distance. The people are complying. They're wearing. I haven't seen anyone yet that's not been wearing their masks, other than those nice gentlemen at the table. They're eating their meal, so that's more than understandable. It's looking great, Dave.
So, and as you can see, people were just walking down the street. People are wearing their masks. Here's a T-shirt shop. They are open. Not a lot of people in here. Admittedly, it's Friday. We've not got into the weekend yet, but admittedly, it just seems to be working out well. Will it be different tomorrow when things open up a little bit more? Probably, but it's really, really great to see what's going on.
Yeah, I'd imagine it'd be a little more different on Memorial Day weekend, but it's right around 12 noon on the first day of reopening, so it's good to see that people are complying so far, and that things are looking good in Charlevoix and hopefully in many other places in northern Michigan. And if this is the example that is being set in this situation, we got some good times ahead of us, hopefully.
All right, Tyler, that's all I got. So that's our report from Charlevoix. I'll see you guys back in the studio on Tuesday. Everybody have a great Memorial weekend. And thank you very much for giving us a couple of minutes here so we could chat. And to you and Erica and our entire team, have a wonderful weekend.
Well, thank you. You as well, Dave. Dave Scott reporting on the ground in Charlevoix. We saw in the restaurant. We saw a little bit from in the shops as Dave was walking around in Charlevoix. Here on the Megacast, and we don't see a lot of reporters from the local area being able to get up there. Luckily, Dave has a place in northern Michigan where he's able to stay and get us a front line report on the first day back in operation for a lot of these businesses in northern Michigan as they continue forward through this process, and we see restrictions lifted in regions 6 and region 8 as detailed by the Michigan Economic Recovery Council and the governor of the state of Michigan. We got just a little bit more time left in the show, about 15 minutes remaining. We're going to take one more short break and come back with Erin Finn, the University of Michigan medical student, track star, and Olympic hopeful on the Megacast, coming up after this short break on our family of radio and TV stations.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
Hi, I'm Dr. Jonay Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
It's the Oakland County Megacast on Civic Center TV in Greater West Bloomfield, on Birmingham Area Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin, on 88.1 WBFH in Bloomfield Hills, a service of the Bloomfield Hills School District. It's the BIF. WAHS 89.5 Avondale Community Radio. That a service of the Avondale schools in Auburn Hills and the surrounding areas in northern Oakland County. Also joined on the West Bloomfield Township Clerk's Facebook page via Facebook Live, reminding you once again, take some time this weekend and fill out your U.S. Census. It shouldn't take you very long. It took me about 10 minutes a few weeks ago, and I filled out mine. Highly encourage you to do that. Lots of municipal services are impacted by that for the next 10 years, and your information is safe for 72 years upon filling out your U.S. Census. Joining us now, our final guest today on the Megacast. She is a 2013 graduate of West Bloomfield High School. In 2017, she received her Bachelor of Science degree in biochemistry from the University of Michigan. In 2019, a Master's of Public Health and Epidemiology, also from U of M, and is currently a first-year medical student. She is also an Olympic hopeful in track. Her name is Erin Finn, joining us on the Megacast. Erin, thank you for being with us.
Thank you for having me.
So how are you? How's your family? How are your teammates?
Yeah, so I'm super thankful that that my family is safe. Both my parents are actually physicians, and so I've been extraordinarily grateful for their help through this, and also just like what they've been doing for the community. My teammates who are still running for the University of Michigan are obviously extraordinarily disappointed with the loss of the outdoor track season, but they're taking it, they're being strong and recognizing how this is kind of just playing a role to keep everyone safe, and so they're getting through that, and they're hopeful that they'll be able to compete, coming up this fall, and if not this fall, hopefully this winter. And then my professional teammates are obviously disappointed as well, but everyone recognizes that canceling or pushing the Olympics back a year is for the best, and for it's to keep as many people healthy and safe as possible. So everyone understands, and it's just kind of something we all have to go through to get through this together.
So you're a prolific runner. I actually have some firsthand knowledge of that, having ran against you in high school at Andover High School. You were always one of those people that was a thorn in the side of our women's team, and even some of the people on our men's team that had rivalries with you with your great cross-country times in particular. So you're a prolific runner, you're an Olympic hopeful, and obviously, as you said, the Olympics have been postponed to 2021. How has that impacted your training, and how does that make you feel, knowing that this potential for a dream accomplishment of yours to be delayed another year?
Yeah, it's actually really disappointing because I was aiming to compete at the trials, the track trials this June. I was hopefully going to be running a qualifying time tomorrow, actually, to race in the 10,000 meters at the trials this June, but obviously that's not happening. And it's also disappointing because just based on the demands of my medical school curriculum, the second year has a lot less leeway to train and to travel for races. And so training is going to be a little bit more play by ear next year and harder to plan out. And so that decreases the likelihood of being able to compete in the trials next summer. But I'm still going to do my best and enjoy it, and recognize that postponing everything is really what we need to do as a society. But yeah, because of that, I'm deciding to kind of take advantage of all this extra time and start preparing for a marathon. So putting in those big miles and laying that strong groundwork of base miles and fitness. And so, yeah, I'm trying to make the best of this situation and really enjoy the loneliness of the long distance runner during this quarantine, and put in some big miles and hopefully debut in the marathon.
Erin Finn with us on the Megacast, an Olympic hopeful in track, a University of Michigan medical student, joining us on the program today. You're also part of a group at U of M, a group of medical students volunteering in the M Response Corps. Tell us a little bit about what that is.
Yeah, so it's actually a really cool initiative designed by the clinical students at Michigan. So the students in their second, third, and fourth years to help out. These kind of the older students saw a need and saw an opportunity to volunteer and to help out during this pandemic. And so they created a kind of an organized way for medical students to provide help, whether that be for the hospital, for babysitting, just for anything that the community might need, for delivering groceries. It's really been it's a testament to how amazing the student body at University of Michigan Medical School is, and just how willing they are to help and to give. I've only played a very small role in that because I've been as a first year student, we're still learning a lot, and we are kind of still in the midst of doing lots of going to lots of lectures and taking exams, whereas the clinical students had to be pulled off the wards because of the pandemic. So they kind of have had a little bit more time to volunteer in these initiatives. But one that I was invited to do actually was to help create a public health based curriculum using the COVID-19 pandemic as a framework for the second and third year students. And honestly, helping out to create that course was really an honor because I have studied epidemiology and public health, and I'm really interested in education. And so it really kind of melded all of my interests, and it was a way to give back to the community in just a little way. And yeah, so I'm really thankful to be a small part of this amazing student body at the University of Michigan.
Erica Jones here. And Erin, I'm just wondering, I run recreationally a little bit myself. So I always wonder, athletes who are so accomplished like you with running, I know you said you're especially during this time taking advantage and trying to get the miles in. Do you ever take a day off from running, or how does that work?
Yeah, actually, it's funny you bring that up because that's something that I've really learned on my journey as an athlete, is that rest is just as important to becoming a better athlete as stress and as working out. So I really do try to implement harder and easier days in training, depending on my fitness level and how kind of hard I am working out on the hard days. That'll dictate if I just take like a short, easy run versus a complete day off. But I definitely incorporate rest into my training, and it's actually been a really essential part of helping me to kind of avoid injury and not get into an injury cycle like I have in the past.
Erin Finn with us on the Oakland County Megacast, a University of Michigan medical student, a West Bloomfield High School grad in 2013. So bringing this back in our last few minutes of the show today to the COVID-19 angle. Erin, you have a Bachelor of Science in Biochemistry, a Master's of Public Health and Epidemiology, a medical student you are at the University of Michigan. So you're pretty in the know about the processes that are in motion to safely, hopefully soon, wrap up this crisis. For those unfamiliar with the processes, such as the creation and the testing of a vaccine or production of certain treatments, how are those facilitated, and where are we at in terms of that timeline right now?
Wow, that is a big question, and I'm certainly not qualified enough to fully answer. But I guess just a few important takeaways that I can provide are that we are certainly in the process of creating a vaccine. I was just reading this morning about a new trial starting in the United Kingdom that is looking successful using a protein vaccine to kind of help establish immunity. But right now, it's still the vaccine, even if we can get it as early as possible, is not going to be widely available until the fall, and that would be an extremely early timeline. So right now, it's just super important to continue to be smart and to maintain social distancing while still making sure we are fulfilling our social needs and taking care of each other. But we just have to do it responsibly, by not gathering in large groups and being careful when we are out in public, and really just making sure that we're looking out for our fellow community members by recognizing that we could be spreading the virus when we feel fine, and also recognizing that others might be more vulnerable than ourselves. And it's really going to be a community effort for a while until we are able to get a vaccine. This will end, but it's, I don't even want to call it a marathon, because a marathon, has an ending. This is super hard because we don't know when the ending is. And so we really just have to continue to support each other socially while social distancing, and let our scientists create a vaccine and hold strong until then.
Erin Finn, a West Bloomfield High School graduate and University of Michigan medical student, with us on the Megacast. Just a couple minutes left in the show. Erin, anything else that we haven't touched on yet that you believe is important for our audience to know, or anything else that you'd like to say?
Oh, wow. I guess just I'm super thankful for the education I received as a West Bloomfield High School student. I've been following along as they've been they've been wonderful in trying to be innovative and creating a curriculum that accommodates, having students be at home. And I've been watching them roll out plans for the fall so they can, do half online and half in person. And I'm really inspired by their willingness to, really create a great educational environment for their students. But I'm not surprised, because I had such a wonderful educational experience there, and it really prepared me well for the rigors of being a student at the University of Michigan, and then kind of was also where it really helped generate my passions for health, both public health and medicine. So just super thankful for my time in West Bloomfield.
Well, we thank you as well for being on the show today and being with us. Erin Finn, thank you for joining us on the Megacast.
My pleasure. Have a wonderful day.
You as well. Erin Finn, Olympic hopeful in track, University of Michigan medical student, and a graduate of West Bloomfield High School back in 2013, helping us really wrap up this week with some important information about this process going forward, where we're at, and why we still need to be very vigilant and very safe out in the communities, keeping our social distance, wearing our masks, and knowing that we're still well from the end of this crisis, and also giving us some great insight from a high-level athlete's point of view on training for the Olympics, on being a college athlete in these times when things are getting canceled, things are being postponed, dreams are being put on hold, and how you can adjust from that and put yourself in a good headspace as you emerge from those kinds of issues. And I don't know Erin personally. I did run against her, and I had a lot of people that I knew in high school that did run against her, and it shows in that interview that the kindness and the intelligence that she brings to our community every single day. And it was great to talk with her and to talk with a lot of other experts from throughout the Oakland County area on today's Oakland County Megacast. Just a couple minutes left in the program. We'll remind you, this will replay this afternoon on WBTV in West Bloomfield, Comcast Channel 19, and AT&T Channel 99. It'll replay this evening first on Civic Center TV after our municipal meeting replay block this afternoon, and all throughout the weekend as well on our regular programming, and will be online on civiccentertv.com for you to enjoy on demand, including these interviews. So if you want to watch one interview specifically, you can watch it on civiccentertv.com. If you want to watch our full show from today, you're free to do that as well. And you can watch our channel on civiccentertv.com in high definition 24 hours a day, 7 days a week. We have a live feed from our channel for you to enjoy, as well as all of our on-demand programming. As far as Monday goes, Monday is Memorial Day. We will not be back on Monday. We will be instead on Civic Center TV having some programming looking back at the last couple of years of Memorial Day festivities in Greater West Bloomfield, as ceremonies and traditions have been put aside and have been canceled. So we'll end the week by thanking all of our partners in making today's show happen. Our guests from Jennifer Tucker from West Bloomfield Parks, Dr. Jamie Taweel from Grand River Medical Associates, the Chief of Police in Rochester, Stephen Shettenhill, Dr. Melanie Schwartz, Rabbi Schwartz from Temple Shir Shalom, as well Rabbi Daniel Schwartz, and Erin Finn, University of Michigan student and West Bloomfield High School graduate. Also thank our partnering stations, Birmingham Area Municipal Access Television, 88.1 WBFH, The Biff, and WAHS 89.5 Avondale Community Radio, as well as our Facebook partner for today's program, the West Bloomfield Township Clerk's Office. Again, take some time this weekend and fill out that U.S. Census. Keep a safe distance from other people. Wear a mask, be respectful, and be kind. We're still a long way from being done with this process, but we're getting closer every single day, and every effort that you make, whether it be wearing your mask, whether it be keeping your social distance, or whether it be something as simple as being kind to your neighbors, to your friends, to your family, and to strangers, helps us go a long way. That does it for this week's edition of the Megacast.